Hello to our What the Health Tech listeners. I'm proud to be your host this week, Ronnie Owens from Radar Healthcare. This is a podcast where we tackle some of the trending topics, ideas, and best practices in health and social care. And today I'm excited to speak with Chris Rawlings, Chief Executive Officer, and Jean Krantz, Compliance Officer at HospiceCare West Virginia. And we're going to talk about how they're using Radar Healthcare and the impact it's had across their organization. I'm also excited to welcome our co-host this morning, Glenn Glatz. So we'll take a moment to let everyone introduce themselves and say hello. But first, welcome to the podcast. Glenn, could you introduce yourself first?
Yes, thanks, Ronnie. Glad to be here. Glad to have this be our first U.S.-based What the Health Tech podcast. So thanks, Jean and Chris, for joining us. And I am the Vice President of Sales and Business Development here in the U.S. So excited to jump in and have a nice conversation with you guys.
Awesome. Chris, how about you? Can you tell us who you are?
Yeah, good morning, everyone. My name is Chris Rawlings, and I am the CEO of HospiceCare. We're located here in Charleston, West Virginia, and we serve the lower part of the state. We provide hospice, palliative care, and home health services to a few thousand people every year in our service territory.
Awesome. And last but certainly not least, Jean. Let's learn more about.
Good morning, everyone. This is Jean Krantz. I'm the Compliance Officer for HospiceCare. I provide policy review, oversight for quality improvement, and implementation for Radar Healthcare.
Thank you. So let's start really by talking about what your work means to you and your team, but especially when it comes to providing compassionate care. You know, we spent some time with you in West Virginia. We were able to see the facility and learn what it's really like to do the work that you do. But I've learned for our listeners and viewers to hear, in your own words, what the compassionate care work that you do means to you.
Yeah. So for me, I've kind of grown up in healthcare over the years. I've been in acute care centers, academic medical centers, and then made my way over to the post-acute side here at HospiceCare. And the team, the compassion, the way we approach care, the way we work with families, social dynamics, it's really significantly different, in my opinion, from the acute care system in the United States. We pride ourselves on taking the extra amount of time to make sure the families and the patients are understanding what's going on, understand the death and dying process, and help them work through that. And even so far as to say, after someone passes away, helping the family work through the grieving process. And that part of life is very fragile and very meaningful. So the work we do, we only have one shot at it. I tell people that all the time. It's not like going to your primary care physician or going to get a knee replacement or something like that. These are once in a lifetime moments, and we have to treat them as such and treat them with the utmost dignity and respect that we can provide to our patients and our families.
Jean, what about you?
So I'll echo what Chris says about this is our only shot. Patients and families have never gone through the dying of a parent or a child. And so we have the opportunity to help that patient and family to live until they die. And so providing compassionate and quality care to them is what they deserve at that time in their lives. So we support the family as much as the patient in the dying process. We support the caregivers in helping them to know what they need to do when the patient needs something, when to call us, and to help keep the patients and the families out of the emergency room so that they can pass in the quiet and comfort of their own homes.
And I would just echo what Jean said a little more in regards to quality of life. A lot of folks think about hospice as the last few days of life, the last week of life. We love to see the long-term patients that are 6 months or so. We have an opportunity to connect with them, to become kind of their extended adjacent family during this time. And we see a lot higher satisfaction from our service ratings based on longer lengths of stay. And so we're able to provide quality of life. We're able to support people who may still be mobile and able to go on trips. We can assist them with traveling to family. We've had people, do a whole slew of different things as their health has started to decline. And one of the neat ones is, recently we got virtual reality headsets. So our patients can take a virtual trip, or they can go and see what their childhood street looked like, or looks like today on Google Earth. And so it's those kinds of things that are really impactful and really drive us towards our focus on quality of life and not just the amount of time we have left.
Chris and Jean, thank you both for sharing about the work that you do. And I'm sure it goes without stating, but providing compassionate and quality care does not come without challenges. And so I'll turn it over to Glenn to learn more about the challenges that you faced and kind of how we're here today.
Yeah, thanks everyone. I mean, it's real privilege for us as a partner, as a vendor, helping you deliver that compassionate care. And I wanted to sort of revisit some of those conversations that we had early on and just share with our listeners some of those initial things that popped up in your business, your day-to-day operations that said, hey, we need to look at something like Radar Healthcare. What started your journey exploring some alternatives to what you are currently doing?
Yeah, so for me and the team, I'm a big believer in standardization reduces variability and can provide, that standard high quality level of care. And so where we started was the event reporting process. Our process was very manual. It was very paper driven. It seemed like every so often we were finding things that were falling through the cracks and weren't getting either resolved timely or weren't being escalated appropriately. The office mailbox sometimes can end up hiding papers for a while. And so I just felt like the process was flawed, and consequently we were not going to get standardized results that were going to drive improved patient and family satisfaction. Also, it didn't give us a great way to aggregate maybe some of the issues we were seeing. Again, with paper, you go through the sign-off process and the review process, but unless you're taking that information and putting it into some, electronic format like Excel and then aggregating those issues, you might not see key themes pop out. And so we wanted to look for a solution that solved the paper process, that created accountability, and that allowed us to aggregate any issues that we were experiencing so that we could develop process improvement plans around those. So that was kind of my perspective headed into the project. Jean, do you want to share some of your thoughts?
So as the person who chased that paper, this process allowed us to get rid of the paper. I can track somebody's progress through the incident in Radar without chasing them down the hallway, waving a piece of paper. Here, please sign that. I need your input. And so, as Chris mentioned, paper got put in a mailbox. If somebody was on vacation for a week, the paper sat there for a week. I might not have known the person was out for a week. And so we had delays in some of our incidents receiving action. That's especially important if it's an employee injury and the need to report to workers' compensation. We have a short window to get that reported or we're fined. And so being able to see when an incident is reported, knowing who owns that incident at that point in the process. And if somebody's out, I can just push that to someone else in their department to react to and to provide the action plan for. So it's helped us to be more efficient, understand where our incidents are, understand if we have a pain point or a place that we need to do additional education. Sometimes we see some incidents that are a theme and we need to back up and educate individuals on what's happening and what's causing that issue.
Yeah, I think the education piece is a big one, right? As we're always sensitive to staff burden and kind of creating this culture of safety and quality. And it sounds as though the platform is offering some value to the frontline staff people from an efficiency perspective. Is that fair to say? Maybe kind of walk us through a little bit about what the frontline staff folks are experiencing and
Sure.
kind of what's kind of impacting their day-to-day world and life.
One key part for us is our staff are scattered all across Southern West Virginia. So because we're providing roughly 90% of our services in individual homes throughout Southern West Virginia, our staff may go a couple weeks without coming into the office, depending on, if they need supplies and different things. So having a paper process clearly doesn't work in that kind of environment. At least it doesn't work well. So Radar, given that it's, electronic, everybody has access to it, they can do real-time reporting from wherever they are in their job duties in the field. That was really advantageous to us as well. I think we have a great workforce, and they're very receptive to process improvements, technological improvements that can make their work lives easier and more streamlined so that we can refocus our time on direct patient care. That's what we're always trying to do, trying to find an extra 5-10 minutes here and there that we can reallocate to direct patient care. So from that standpoint, the reporting, the technology, it was very advantageous. Jean, you want to add to that?
I would just echo that we have a tremendous workforce. We have 280-ish employees, and trying to get paper from one to the other was virtually impossible on some days. And so having the ability to give them an electronic login, they could report an incident, didn't have to be complete, but then we could add to that and assign it to the next person, letting the workflow complete the incident so that we had everything in one place really has made a difference for us.
Yeah, no, I just love to hear more about the implementation and the rollout process because, Chris, you said you have employees all over Southern West Virginia, about 280 or so. So what was it like scaling and rolling out the software?
Sure. Well, I scheduled a meeting with Jean and I said, I like this software. Let's roll it out. And then we accomplished it. So I would have to hats off to Jean. I think she's probably the best one to take that one.
Well, after that call, then I went, okay, let's make this happen. And so I scheduled a meeting with the project manager from Radar. Craig was very patient, worked with us until the platform was set up to our satisfaction. Every week we met, we worked through a particular piece of the platform that I needed to work out so that the electronic process mirrored our paper version without the paper and tracking of the paper. Every week he gave me homework, things that I needed to do to work through to keep us on task for the project implementation day. Once we had the platform where we wanted it, our system is set up so that the line managers receive the incident based on the individual that creates the incident. So whomever the employee reports to down the line receives that incident. And so we used virtual opportunities to train individuals across the state. We didn't require them to come to the office and travel an hour or so to get here to learn. And so we set up virtual opportunities for the employees to learn about Radar, work through their logins, getting their passwords set up. And then we just scheduled some follow-up calls with employees, supervisors, so that we could work through the incident reporting. It's pretty intuitive in that it asks questions, and we were allowed to set up mandatory questions. We set up the system so that we didn't have as many mandatory questions in the beginning as we might farther down the line, because it was important for the employees to be able to get through the incident and be successful and have confidence in reporting. And then I can go back and add to an incident any place that they might have missed something. As we mature in our use of Radar, we'll add some mandatory fields so that as folks have confidence in using the product, then they will know, I have to answer this question. There's additional information that's required. And so it's been by just implementation through individuals and giving opportunities to the supervisors to own the product.
That's awesome. And Gene, I heard you mention earlier about the workers' compensation claims and things. Can you share more about how the system has helped you improve for other audits or insurance claims, and examples of just how it's helped you be prepared and again, not having the paper, you now have everything in one place. So how has that helped you?
So OSHA requires us to report particular employee demographics, their date of birth, the date of hire. And so we took the form that OSHA requires that we complete on an annual basis for every employee that has an injury, whether it's a needle stick or a bruised knee. We have to complete that form. And so we were able to build an exact replica of that form in Radar so that when the incident is reported, then that form is part of that incident and it's completed. At the end, we can print that report or that form and submit that to OSHA on an annual basis. That form, when it's launched in Radar, sends an email or a notification to the HR folks, and then they know there's been an incident that they perhaps have to report to workers' comp based on the severity of the injury. So we've mirrored our paper process, except electronically.
Yeah, it's all about those efficiencies, right? It's, saving time, even going back to Chris's comment about, more time with patients, more time at the bedside, whatever we can do from a technology perspective to free up that time to spend with your patients and families. That's great to hear.
It is. And so it sounds like implementing the Radar system has also reduced your administrative burden. And would you also say that it's built a level of trust and confidence? I could imagine as an employee knowing that if I'm injured on a job, it's being tracked appropriately, it's being handled. It gives a bit of visibility, to say, hey, I did my part. I know that the company's going to do theirs. Can you share more about that?
Yeah, so I think one piece from an employee standpoint is that the company is being accountable, right? That we are taking a look at what is happening, and then it becomes our responsibility to do something about it. So if we see common occurrences, interestingly for us, dog bites can be something that we see a few of a month. And so if it's happening with the same family, we have quick visibility into that. We can call ahead of time. make sure that the dog is in a secure area that won't get to our employees. Falls. That's one where we can start to peel back the onion a little bit and say, are falls happening at a certain location on a certain shift by a certain employee? Maybe we need to do some additional training with someone if they have a frequent patient fall situation. So the ability to slice and dice the data and aggregate it and for then the company to act on it really, I think, is advantageous for the employee. The employee might not know they need more training, right? But if we have line of sight to say, you've had 3 patient falls this week, let's retrain you on how to bathe the patient or get you some additional help while you're doing it to try to prevent those going forward. So that's kind of my take on it. Jean, what are your thoughts?
So every incident that is raised in Radar goes through the process. The line managers review it, create action plans. But I think the big deal is, in the end, every incident that's raised is signed off by Chris as the CEO. So he knows and understands every incident that's being raised in our organization, whether it's a small event or a dog bite, something that means a lot to an employee.
Yeah, I think sometimes we hear about the collection of data, and we still hear it today as, oh, we want the data, but that's sort of what do we do with the data? But it's all about improvement, right? So you're using the data to just make you better at what you do. So whether it's a staff member or a family member of a patient that you're serving, it's all about leveraging the technologies and improving for all of your people. And the other thing that we hear is creating that culture. A lot of organizations struggle with fostering that culture, especially across a diverse and geographically spread out workforce. And it's nice to see that sometimes technology can play a pretty impactful role to help create that kind of culture. So thanks for sharing that.
Yeah. And that a lot of that comes down to the tone at the top, right? So we have a process improvement culture here. We try to be transparent when things break down. We don't want to hide our failures. We want to learn from them. When you fail fast and fail forward. And this technology allows us to see those failures, have line of sight to them, and then to act on them. And that's really where management has to hold itself accountable to do the things, the next steps to prevent those going forward and to learn from them. And so that here, we're process improvement driven, we're quality improvement driven. It's in our blood, our DNA, and Radar really allows us to leverage that culture and have actionable outcomes when things do fail through the process.
Yeah, it's great.
Jean, you're not just using Radar for incidents. I think that's what initially led you to us, but you're using it in other ways. Can you share more about the other ways that you're using the platform as well?
Currently, we are using Radar Healthcare as a document repository. If you've been around me any time at all, you'll hear me say, what's your source of truth for whatever it is? And so we needed a place that an employee, no matter what their level on the organization chart, could go to get a policy, receive a form, understand our procedure, and know that it was their source of truth. So we've entered all of our documents, policies, and procedures into Radar Healthcare. The employees have access to Radar Healthcare so that if they need a current admission form, they go to Radar Healthcare and they pull down the admission form, print it, and use that form, and they know at that point that's the most up-to-date form, and it is their source of truth. So that has been a good process for us because it allows the employees to go to a place they're already familiar with because they go to Radar to report incidents. Now they go there, same place to get policies, procedures so that they can do their daily work.
Yeah, and I think we've all worked in the places where a certain form or other type of document has been copied for the last 10 years. And, administration updated it last week and has updated it a dozen times since the form that's out there being used, that's just copied again and again and again. And so having a true document management system allows us to have version control. It allows us to know that we're reviewing these policies, procedures, documents on a triannual basis or more frequently, depending on, our internal policies around that. But it just creates something we can rely on so that staff aren't out there with their binders of documents that are not updated, not in real time, and give them a place where they can be confident that they're printing it off. Management has signed off on it. It's been reviewed. It's the most up-to-date version. And, that's really important in a regulatory healthcare environment. There's a lot of changes that happen annually with Medicare or new regulations from HHS. So making sure that we are even so far as to say our admission packets, there's language that has to be in there about contacting CMS if you have a dispute, phone numbers that might get updated, all those really nuanced things that we review and update. Now they can filter all the way through the organization reliably to know that we're meeting all the regulations we're supposed to.
And when we upload a new version of the document, we're able to put in that entry for the new document what changed from the previous version to the new one. And so we can write just a bit of a blurb in there that alerts the person pulling the document down who might say, well, this doesn't look like the last one I used, to understand this is what changed from the last version to the new version. So that's helpful in understanding why changes have been created in a document.
We continue to hear that, whether it's, your, home and hospice and palliative care, really any other care segment, just the level of regulatory kind of scrutiny is just, it's not going away. It's not getting less. It's kind of only going to increase. So managing all of those paper documents, I'm sure was a struggle for sure. And you're not alone. We talk to, a lot of folks out in the care space, and a lot of folks are still struggling with paper and managing those types of things. So again, it's nice to hear how some technologies can support some of those, more time-consuming processes.
And Chris, I can really hear your passion around standardization. What would be your advice to any other CEO or hospice organization that's considering a digital compliance solution to help their operations? What would you say to them?
Yeah, so technology can be intimidating. Change can be intimidating, but Radar has made it pretty easy for us to get stood up, to scale the system, to educate employees. It's very user friendly. So I think your ROI as a CEO, you're making a lot of decisions. Is this going to be beneficial for the organization? Is this a good use of our resources? All it takes is one lawsuit, one workers' comp situation to cost far more than the price of the solution. So from my standpoint, not only was it a positive ROI from a soft cost standpoint, but even those hard costs, the regulatory risk reduction that we were able to experience due to radar made me sleep better at night. I mean, I think as a CEO, you got to worry about sustainability. You worry about kind of big ticket items that are large risks to the organization, and anything from a regulatory environment has the potential to be that. So reducing that risk for the organization using the radar solution, for me, helps me sleep better at night.
Yeah, that's great.
That's great. And Gene, I know you're preparing to ride off in the sunset soon, and you're training your replacement. But as you're leaving and training someone else to come behind you to use the system, are there any features that you would like for them to explore more deeply, or something that you like to see evolve in the next year or two?
Sure. Our next project will evolve around contracts. We have contracts with hospitals, nursing homes, assisted livings, DME vendors, durable medical equipment vendors. So we want to be able to track those contracts. What are their renewal dates? Who's our contact for those contracts? And to be able to have a repository around all of the contracts, assign users to track those, work through the process with whomever we work with in the organizations, so that we have the same sense of security, knowing that our contracts are up to date. We don't have a contract that's outdated, that's going to be a surprise when the regulators come to visit. And so that will be implemented pretty quickly.
So, Chris, you've already shared how the compliance process and being in order helps you sleep at night. So that was one of our questions that you answered. I just want to turn it over to Glenn for any final thoughts before we end with something fun on the end.
Yeah, I just want to thank you for all of when we enter into kind of relationships and partnerships, I think we learn just as much from you all than you learn from us. So it's been mutually beneficial, and we thank you for teaching us your world, some of the challenges, and really kind of informing us how we can best kind of leverage the product for others in your community. And it's been a real pleasure working with you, and we look forward to many more years of working together, and maybe we'll do another podcast or something else that's sort of fun like this. So thanks for joining us. And
absolutely. And I would say, from my standpoint, there's so many technological choices out there in the market today. And deploying new technology at the end of the day does take a little organizational investment and time. So when we look for new technologies, we're not just looking at the functionality, we're looking at the partnership that it's developing. And so when we decided to go with Radar, we felt like we were developing a relationship with people, with an organization, as well as with the technology. I'll be the first to admit I've chosen technologies before that we've decommissioned within 6 months because they didn't have those kind of 3 key pillars. So just appreciate you guys and the relationship we're developing in addition to the technological solution.
I'll make one other final comment here. So when Gene and I were originally talking, I remember talking to some others internally, and I said, I think we found a radar rock star. So Gene really knows her stuff and really kind of took Radar by the reins and was great to work with. So Gene, we're gonna miss you. I know you'll get someone coming in behind you to kind of take over your role, but I knew from our first few conversations that this was going to be a good fit.
Good. That's great. Thank you.
Now, at the end of each episode, we ask our guests to tell us about their what the HealthTech moment. And so, Gene, we had a bit of fun yesterday just when we were talking about this. So I'd love to hear any of your wonderful stories that you've experienced in health and social care that you'd like to just share with us today.
So I'll share one incident that we had. we had a patient in our inpatient unit. The grandson of the patient came in and snatched grandma right up out of the bed and took off out the door with her. And so you might imagine the looks on everybody's faces when grandma is going out the door with her grandson. Is this, do we call the police? Do we run after them? And so it was a bit of an incident, but it gave us something to report in radar for sure. In the end, the grandson brought grandma back. All was well. Grandma was good. Grandson was okay. But it was a bit of an interesting situation to watch the grandson carry her out the door.
Yeah, I don't know if we have that as a specific incident type, but maybe that's a new one.
We found a way.
Well, thanks for sharing that. That's I love those stories.
Chris, I wonder, is there anything that's happened in your world that you like to share as well?
Yeah, I health tech wise, this is a little outside of that box, but just to give you a sense of the quality of life we really focus on, we had a gentleman, veteran, mid-40s, no family, end of life, and he was stuck in a nursing home. And for any of us that have been in a nursing home, it's a kind of a somber place. There's not a whole lot of activity going on, especially for somebody middle-aged who is facing the death and dying process. So one of the things we did is somehow we found out he really liked to play video games. He didn't have much money, so we bought him a video game console. And then the nursing home nurses started buying him video games to play. And you would have thought this guy just got a new Ferrari and was driving around Monaco, right? I mean, he was so happy. His whole demeanor changed. Certainly wasn't a cure-all for his disease process, but the fact that we were able to bring some compassionate care to that gentleman as he's approaching the end of his life really just speaks to our mission and what we're here to do. So that happened last week, and that really made an impact on me.
That is awesome, Chris. Thank you for sharing. I'm sure that was amazing. I'd be interested to know which game. He's probably playing Fortnite like my son.
Yes. Right.
But thank you again for your time that we spent today. Like as Glenn said, learning about your operations and how you're using the system. This information is valuable to us as we are, moving into new territories here in the U.S. So again, thank you for joining us this week. Thank you for all of our listeners as well. We hope that you join us next time for a new episode. And don't forget to rate and subscribe. And if you have any questions for us or our guests, please email us at whatthehealthtech@radarhealthcare.com.